everyone. Welcome to one of our final episodes for the Great Nurse Podcast for 2023. We're doing a year-end wrap, but I think it's so important that we actually we're going to cover a lot today, so maybe it's going to seem a little bit all over the place, but we have to start with this most, I would say, damaging report to our Ontario government right now, which is Doug Ford, who's in power. We've probably talked about this individual and just the issues that plagued our healthcare system over the past 3 years. And this Auditor General report is damaging. We are talking about a third-party independent report saying, here are the things, the missteps, the failures within the healthcare system. Of course, we've been saying this time and time again, but it's nice now to hear it from a third party. And I think it's just, I don't know, it just is kind of like the icing on the cake for us to be like, this is the stuff we've been saying for the last 3 years, and now we're hearing it coming as an independent report.
Yeah, and the thing is, how many radio interviews, how many TV coverages have we done? How many podcast episodes have we done about these same issues? And so for nurses, I think it's really validating to hear from someone else that, yes, what we were saying all along is that we did not get the support we needed, that patients weren't getting the care we needed, and there's proof here now that this was the case. So we're going to start by going over some highlights. We'll talk about each point and discuss a little bit about what we think.
All right.
And I don't think any of this is going to be a surprise for anyone that works in healthcare.
No, I don't think so either.
Okay, so the first one is that 1 in 5 emergency visits involve patients going to the ER for non-urgent issues because they didn't have a family doctor or access to other services.
Another thing that I think that we had been touching on and focusing on, talking about the issues where there are millions of people in Canada who have no access to primary care, that we just need to do things radically different. Yesterday, I actually had the opportunity to speak to Haley Wickenhauser, and I think I just said her name wrong, but I'll have to circle back. Just yesterday, I was able to speak to an Olympian, and she is now turned into a physician. Her name is Haley, and I think it was just important, the fact that she pretty much said to me and pretty much said to the crowd that she's like, yeah, I picked a subspecialty in family medicine, but who in their mind would want to do family medicine based on just how our system kind of treats family doctors. Mm-hmm. Again, we have this family doctor shortage, but I think we need to start thinking creatively here. We need to start thinking about how we can service all of these people who don't have access to primary care. And the other piece I brought up was health literacy, right? I think the reason folks visit the emergency departments, whether, it's people who are new to Canada or new to the system, is because they don't know where else to go, or they don't have a primary care provider. So we can't fault people for coming to the emergency department for, non-urgent issues when they don't know where to go and the health literacy is not there. Again, I would say this is another failure on the Ford government's behalf, because we've been sounding the alarm on this for years, and nothing has been done. And
the other thing is, I just want to point out that just because someone has a primary care provider does not necessarily mean they can access that provider, right? So, okay, you call someone and you have an issue that you need someone to see you fairly urgently, maybe the same day or the next day, and they give you an appointment that's 3 weeks away. Yeah. That's not helpful. So we're talking about, and this is not to fault primary care providers. I'm sure many of them are overworked and underpaid, but it's to say that there aren't enough. So even if you are lucky enough to have someone, it doesn't mean you can actually access them. Maybe they're on vacation and there's nowhere to cover, or you call and no one answers. Like, this is not accessible healthcare. This is not the healthcare that we should have as Canadians.
And the other thing is, speaking on that, is Doug Ford, when we had virtual care because we needed it during the pandemic, we needed other ways, he slashed that right out of the budget, making it not even really feasible for physicians to want to use virtual care models. And that was a whole other crippling aspect. There were some folks that are like, this is really working for me. But he made it that it was, again, another task that physicians would have to take on with not additional supports and resources. And again, another huge failure within the healthcare system. So I'll move to the next point, which is between 2018 and 2019 and 2022 and 2023, Northern hospitals increased usage of nurses from staffing agencies by 25 times. The agencies charge 3 times the rate of an hourly nurse compared to an increase of about 2.5 times for hospitals in the rest of the province. Holy That is insane. And again, we're like, okay, so we talk time and time again about the value of nurses, making sure that, you know, nurses are fairly compensated. This government took the time to sue nurses when we knew that that bill was unconstitutional, Bill 124. And instead of doing the right thing by, you know, ensuring that nurses have access to full-time work, there are more, you know, resources for nurses to have, he wanted to sue us. So again, and again, I'm not going to blame nurses who go and work for staffing agencies, but again, it's a huge problem. The government we need more oversight in making sure that these third-party agencies, private agencies, aren't just making a monopoly off of healthcare and hospital systems. These are our tax dollars going to pay, what did we say, 2 times, sometimes 3 times the amount of a regular nurse to support the system. And again, this is hugely problematic.
Absolutely. And I just want to touch on better working conditions for nurses, because the thing is, these agency nurses are the same nurses that were in the hospital previously, getting paid their straight hourly time. But it just highlights to me that there's a better way to operate when it comes to staffing. And the reason that nurses go to agencies, number one, I'm sure, is for the pay, but number 2 is the flexibility. So let's work with some more flexible working models that actually support nurses, that can give them the time off that they need, and really just make sure that they want to be at the bedside. Like, I don't think it's rocket science. If private companies have figured out a way to do it, I think we need to start innovating, like, on all fronts.
Yeah, it's also, again, like, it's about compensation. Like, nurses wouldn't leave to, you know, not work in an organization because, you know, they're not being adequately compensated. And I think that, you know, when we think about these private entities, that, again, this is our public tax dollars going into a system that's completely inefficient. Again, we have to think about what it's like sometimes working with an agency nurse who's never maybe worked in that unit. We're talking about, you know, these people the role is to come in and hit the ground running, but it's never like that. You know, if you've ever worked with a nurse who's never worked in your unit, there's some orientation that needs to be done. So although they are there to help and support, there are still some challenges within that whole system. And again, they're the fly, and they come in and out, and that's it, right? So there's no continuity of care. So we have to start thinking about how we do things, like, outrageously different. And I think, you know, we'll probably touch on it in another episode when we do our update for the Nursing Retention Forum, but there's so many things that, you know, this toolkit in 2024 will deliver in terms of saying, here are some things that was designed by nurses, created by nurses, for nurses, to say, here's what nurses need in the healthcare system to, one, want to stay there, and 2, to be actually, you know, treated properly and adequately. Because again, time and time again, we're seeing the mistreatment of nurses, we're seeing them hemorrhage and leave, and we're seeing them go to staffing agencies.
Absolutely. And when you're being told that there's forced overtime, that you're not allowed to take time off, what does that actually do? That sets you up for burnout and failure. I can't think of any other way around it. Like, can you imagine being literally told you can't leave until the next shift comes, and then nobody shows up?
Yeah,
that happens
crazy.
So many times.
Or just, you can't do that vacation, you can't go on your wedding. Like, we've heard all that too. So I mean, just so much change needed. And again, I think we have to continue to poke our finger in the middle of the chest who the person is in terms of the decision making. Right. And again, I think there was evidence that said that, you know, Doug Ford was talking about all these various privatization forms, and that, it's going to be a cost-effective measure. They're a government that's supposed to be reducing the budget, and we're spending 3 to 4 times more on healthcare using privatized services. Again, many examples of how we knew that would be a failure, and yep, there it is.
Yep. That brings me to my next point, which is, we heard a lot of media coverage about unplanned closures of emergency rooms, but it actually shocked me to see this in writing. So between July 2022 and June 2023, there were more than 200 unplanned temporary emergency department closures involving 23 hospitals, mostly in rural or remote areas, and mostly due to nursing and doctor shortages.
Yeah, it's horrible. Like, I think we've talked so many times about, you know, the Minden Hospital there. It's like completely closed, right, in terms of the emergency services. And I think how crippling is that as a community if you don't have access to emergency care, or just because of the shortage and because of these issues that the government has not been paying attention to or is completely neglecting, that services are no longer available. This is, again, the fault of our government. We have been sounding the alarm about shortage. Like, how many interviews do you think we've done in the last 3 years talking about nursing shortage? And again, I want people that are out there listening to understand it's not a shortage of actual physical bodies. It's a shortage of the ability to properly staff units, to respect and retain nurses. Why would no one wants to work in an environment where they're not heard, they're not respected, they're treated poorly? I think we felt, and I think I'm not the only person to say this, that we felt almost attacked by this government, felt that we weren't listened to, we weren't heard, our constitutional rights were being infringed upon. And the fact of the matter is like, he just didn't care. He showed up at hospital settings, but never really engaged with nurses, never really engaged to have a conversation. I think we've invited to say, hey, we'll have a conversation with you, Doug Ford.
Oh, by the way, this still stands. So if Doug 100%. Ford or anyone's
come on,
listening,
Doug Ford, we'll talk to you.
Doug Ford, this is an open invitation to come onto our podcast anytime. We're happy to have this conversation. Okay?
Absolutely.
So you heard it here on the Gritty Nurse podcast.
You heard it here first on the Gritty Nurse podcast.
Oh my gosh. But I actually know someone who was in labor and could not find a hospital to deliver at, and almost had to deliver on the side of the road. Like, that is freaking scary. I can't imagine living in a rural area and like having something happen urgently and not even knowing what hospital to go to. Because I think the other thing is the hospital closures weren't always communicated clearly to everyone.
Right.
So then you drive to one, find out it's closed. Drive to another one, find out it's closed. Like, what is going on here?
Yeah, that's like a huge patient safety issue in general. And I think the other piece is like the whole aspect of, not supporting rural areas. We know that that's a whole health equity issue, right? Again, if you're seeing hospitals in the north or or northern regions that are being closed, what population is that affecting? Is that affecting more Indigenous folks? Like, we're still having conversations about folks not even having access to clean water. So the fact that these rural organizations and hospitals that tend to be closed over time and time again, these are the folks in these communities that are suffering the most. And again, it's another huge conversation in terms of how do we support and get folks wanting to work in rural places, because again, they hear these horror stories time and time again, and it's hard to keep people, like good people, out there. And we had the opportunity to speak to the Nunavut nurse, and she's amazing. But again, she talked about the challenges of her being one of the sole people out there caring for an entire community. So again, we need to keep our focus and our eyes on a variety of different things. And again, this is maybe also talking to the federal government about how we can have sustainable plans for rural organizations, not just here in Ontario, but just across the board in Canada.
Absolutely.
Oh, the next point is for me.
Yeah.
Oh, so this, again, not a shocker, but nursing and doctor shortages led to obstetric services closing at 10 hospitals in the north between July 2022 and September 2023. 4 were still closed as of September, with 3 of those closed for more than 1 year. That is insane. I think about myself being pregnant, and I couldn't imagine not being able to access obstetrical services. Can I tell you, when you are in labor or when you feel that something's going wrong, getting into a car and driving for 2 hours is probably the last thing that you want to do on your mind. And I think this is unconscionable that we have to have people go through this. And again, I really hope next year we'll focus a little bit even more on women's rights, women's leadership, and just kind of women forging the way forward for healthcare and a variety of different things, because we're being underserviced. Again, I couldn't imagine this happening to a prostate clinic or something where, it's a disease that's affecting primarily men, where, we would see that there'd be these huge gaps in service. We need to start focusing more on women's health care. And I can only imagine how we're dealing with 2 patients, mom and babe.
Yeah. And I think that obstetrics is a really specialized service too. So I think about all the nurses that were working in these centers who are now not delivering, right? And I think even just speaking as a nurse, right, if you haven't delivered for a long time, you start to question, like, am I like current on my practice? Like, what do I do now? Do I just go work on a general surgery floor? Like, what do I do with these specialized skills? And it's really a shame that these nurses are losing their skills because they've decided to close these hospitals that are so badly needed.
Yeah, it's really abysmal that we're put in these situations, and I can only think about the healthcare providers that, you know, feel that they have those skills, but they can't practice because these places they're so short of, you know, staff that it would be unsafe. And again, this is where we, like, for example, in obstetrics, it's typically 1-to-1 care. Yes, you might have 1-to-2 as long as the woman's not on oxytocin, which is a drug that helps bring about stronger contractions. But it's scary where, you know, there have been situations where people are, you know, they might have more than 2 patients, 3 patients on PIT. And it's a scary situation. We have to make sure that at the end of the day, we're always thinking about patient safety. And if they're closing these places, it's because it's unsafe. And that should be sounding the alarm bell for our government to step in and do something. And again, failure.
Okay. And the last point here is going back to emergency rooms. The wait on average was 2 hours to be assessed by a physician, up to 30 minutes in the last 10 years, and wait more than 24 hours if they require an inpatient bed. So, I mean, like, so you arrive to the emergency room, right? Just to even be seen by a doctor, never mind being treated, just to be seen, it's 2 hours.
Right.
Right? So that is a long time. And then up to more than 24 hours if they require an inpatient bed. I heard stories about people waiting in hallways for 5 days.
Yeah, I can speak to some personal experience there.
This is actually shorter than I thought, but this is horrible. Like, I remember there was an article last year about a woman who was quite young, like maybe in her 30s, who died in the emergency room because she was having severe abdominal pain. Yep. They didn't attend to her until she had fallen unconscious and she passed away.
Yeah, there are many stories like that, it's heartbreaking, right? And it's, imagine the staff that know that they're overworked. There's not enough people on to have to deal with a situation like that. Imagine the families and the impact to the families where I think there's also this disconnect where people don't realize how bad things actually are. But I could only imagine, you know, that family that's just kind of like, you know, my loved one who's in their 30s came in with abdominal pain and now 24 hours later or less, they're dead. And it's because they weren't receiving the adequate care that they should deserve to receive. And again, no fault of the practitioner side, but the fact that, you know, our system is crumbling. And I think this is where we've been talking about this. Again, I can say, you know, my own experience where I had gone in, I had severe, I guess it would be right lower quadrant pain, only to find out that they were having difficulty diagnosing whether it was my appendix or it was my ovary. They finally found out what it was. But again, I still ended up staying in the emergency department for over 24 hours until there was a bed available for me to actually have the emergency surgery. So again, doesn't matter whether you're a healthcare provider or, you know, you're like, you can't jump the queue. And if there's no space, there's no space. And I remember seeing other people that were there in the emergency department way longer than me and hearing that, you know, this person's going on hour 36. And I tell you, when you're in the emergency department and you're in a cramped space, you're hearing people screaming, crying out for pain, and it's just busy and there's so much chaos. It is not the best place for you to be if you need to be somewhere else, whether it's on another unit being seen. We've been talking about this for so long, and it's just, at what point does the government care? I mean, when I'm talking about headlines, and I think you can probably relate to this, most of the headlines I've been seeing about the Ford government have been about the spa, this like Ontario Place spa, or, you know, the Greenbelt scandal that he's been tied up in. Now is like, he had all this land, now he's giving it all back because people are just like, caught him pretty much with his pants down between his legs of all these scandals that he was embroiled in. But the thing is, no, we're hearing very little from this government about healthcare, and these are the things that people want to hear about: healthcare, affordable housing. These are education. These are the crux of what not just Ontarians want, but Canadians want. Because again, we're seeing the ripple effect. Like Alberta, I feel sorry for those nurses. I saw a post today about the nurses just saying, like, we are in dire straits here with what the government's doing because they're fully overhauling the whole entire healthcare system. I don't know if Danielle Smith has a vendetta against the healthcare folks just as Doug Ford does. I don't know, but it's like, it's hard everywhere. Seeing posts from Saskatchewan, nurses in Saskatchewan striking, just a variety of different things happening this year. And I just thought that to think about all of what's happened, we now get this damaging report from the Auditor General. And I just want to read another title where it says, hospitals plagued by staff shortages and ER closures under Ford government, the Auditor General finds. And again, it's just, what more can we do other than alert the public, inform them and let them know what's happening, and hopefully they stand behind us healthcare providers to say enough is enough. And how much longer is this term? 2025. Like we've got our work cut out for us, and I think that maybe we're demanding that he steps down. I don't know.
Yeah, I don't know, Amie, but I think just going back to the nursing shortage, we mentioned that there is no shortage of people trained to be nurses. There's a shortage of nurses willing to be abused by the system. And I'm using that word because it's what's been happening to nurses for a very long time. And just a lot of nurses aren't willing to put up with it anymore.
I completely agree. And I think that, if this is not the time, I don't know what the best time is for us to continue to collectively raise our voices. I think that, I'm so excited that we still have a chief nursing officer of health, and nursing particularly. And again, I think we all have a role to play, from a role in terms of advocacy, in terms of raising our voices when we see things, in terms of whistleblowing. And I really hope that maybe 2024 is the year for you to help join us in terms of raising our voices. We're coming out with the book, The Wisdom of Nurses, to again share our wisdom with many other folks in terms of how nurses have so much to contribute to conversations, whether it's related to healthcare, politics, the environment. We just have so much wisdom, and I think it's important that people know. So April 2nd, look for it. It's available for pre-order, and maybe we can start talking a little bit more about some of the positive aspects of our year-end in review.
Absolutely. We've had a super busy year, and I just hope that anyone listening can do a little reflection on the successes you've had over the past year, because until you write it down, sometimes you don't realize all the things you've accomplished over the year. So some of the things that we did this year, if you guys have been following us at all on social media, you know that we had a pretty busy year. So just starting kind of near the earlier part of the year, we were invited to be on a nursing retention forum with the Government of Canada. So Dr. Lee Chapman headed that program, or that project up, and we were able to contribute our insights into actually developing a toolkit and a framework for how to retain nurses. Right. And that report came out, and like Amie said, there's an update to that as well. So that's available. You can check it out. We'll put the link in the show notes. Just moving on to the next one is that we attended the ICN conference, so the International Council for Nurses conference in Montreal, which is a really big deal because it was the first conference after the pandemic, and it's only every 2 years, and it happened to be in Canada, which is amazing. So yeah,
we didn't have to travel too far.
Yeah, that was cool, right? Because seeing so many people in person and people recognizing us, and like we hadn't done very much stuff in person, right? So that was kind of neat.
Yeah, it was a weird vibe, because I think that, like, I don't know, like, I think people know our names are Amie and Sarah, but we got called the Gritty Nurses pretty much the entire time we were at the ICN, which is cool. But it was just a weird vibe for people to come up and say, hey, oh my gosh, we know you, we listen to you, the Gritty Nurses, and we're just like, anything we can do to help, yay. So, but it was really cool. I think we were able to meet with some political leaders. We were able to meet with the Minister of Health at that time, Jean Duclos, and we also were able to meet with the Prime Minister and have a couple words with both. So that was kind of neat. I think Sarah checked out his arm and checked out his veins.
Okay, and that part may or may not be in our book, so just keep that in mind. Just about like I'm a nurse, whether I'm at work or not, and I always notice people's veins. Okay,
it's all good.
So yeah, that was pretty fun, and I think people recognize us more together than separate, because we experimented. We split up for a bit. We sat in different parts of the room, and I think the number of people coming to us like slowed down, which was kind of interesting. So I'm like, we're a recognizable duo,
right?
Okay, so we also traveled across the country to our first in-person speaking engagement. So we went to Alberta to talk to some nurses there at a really cool event. where we had lots of food, lots of things to drink, lots of things to talk about. And so that was really fun.
Yeah, I think it's just nice now to kind of to get out, right? I think that's one of our goals for 2024, that, you know, we speak to more nurses in different provinces. So we had the opportunity to speak out in Alberta. I've had the opportunity to speak out in Saskatchewan, but, you know, maybe some of the other maritime provinces and maybe some of the other provinces like BC can reach out to us. We'd be happy to come out and speak to your nurses about some of the work that we've been doing and how to continue on their advocacy journey. I think that, you know, again, as nurses, our advocacy does not end at the bedside, and whatever we can do to help support, to bring about change, to bring about innovation, to bring about courageous conversations, myself and Sarah are definitely happy to do that.
Mm-hmm. And we had two huge stars, I want to say, on our podcast. So Nurse Hadley and Nurse Blake. That was super, super exciting. I remember doing an episode maybe 2 years ago where we talked about people we would want to have on our podcast. And I said, we'll never get him, but I would like Nurse Blake and Corey Bush to come onto our podcast.
We're still working on Corey Bush.
1 out of 2 is not bad, right?
No, I think that's actually a pretty good number, right?
Yeah. So I was like, I think we were just in shock, and just like, they're just both so humble and so down to earth. We really enjoyed having both of them on the podcast, and we ended up going to the Nurse Blake show as well. So that was super fun. Got to meet him backstage. So that was a definite highlight for me.
Yeah, and in 2024, Sarah, I was supposed to attend, but Sarah will be going with my cousin Matthew Shepard to the Nurse Blake Nurse Con, Nurse at Sea. So that'll be fun. I was supposed to go, but, you know, changes happened.
Have you actually made an announcement on the podcast?
I don't know if I have. Yeah, I'm having a baby in April, so a book and a baby. I mean, it's all good. So I'm due April 22nd. Yes, I'm due April 22nd. So we'll see if anything happens. If I go a little earlier, I hope I don't, but that's the date. But, you know, I think April next year will be an exciting time for all of us. So you'll get to see a new book and a new baby.
There's so much coming up.
A new female, another green nurse, another girl we're having. So,
yeah, so April 2nd is our book release, The Wisdom of Nurses with HarperCollins. April 9th to the 14th is when Matt and I are going on Nurse Con. So that's leaving out of Miami. If anyone wants to join us, we'll be doing a little roll call. You know, don't be afraid to reach out to me and say hi. And then April 22nd is when Amy's baby's due. Could come earlier, right?
We're hoping not. We're going with that date.
So that was just some exciting stuff. And yeah, we might be going out to Alberta again.
Yes.
Yeah.
Maybe.
So
potentially in the new year. So, yeah. But I think one of the things that is always good as a wrap up, as a year in review, is just thinking about all of the conversations we've had. We've had so many great conversations with many other guests, just in general, right across the board. And I think that as we look to 2024, I really hope that we can have more conversations about women's health, because that has been something that I've been seeing kind of traversing over the past couple months, that there's not enough focus on women's health. I saw that Canada's actually underperforming. I think we were something like second to last in terms of performing surgeries for endometriosis. So even talking more about like, why are these things happening and why are we being really left, you know, off the board, and talking a little bit more about women's leadership. I had the opportunity to have conversations with, her name is Dr. I hope I say her name, Laura Deserview. I hope I said it right, but if I didn't, I'm going to spell it out so everybody knows how to find you. Who's a nurse that is doing some amazing things for women and for leadership and for entrepreneurship. So I really hope that we have her on sometime too in the new year, and just, you know, continue to broaden our horizons. I have no idea where we will end up next year. Like, I have no idea. I'm just kind of wherever the wind blows me, I'm like a paper bag in the wind, just going wherever the wind takes me. And I think this is just such an exciting journey for us to be on. Like, if you asked me 3 years ago if I was going to be an author, I would have been like, no, I'm destitute. I have nothing. I'm in the worst place of my life. And I think through, again, having shared conversations, talking about things that really matter to us, it was able to, give us voice and ensure that nurses didn't feel silenced. And I hope that we can continue to do that throughout 2024 with more amazing guests, more amazing events that we'll host, and, you know, with a huge book drop. So I think that'll be really great for 2024.
And I just wanted to thank everyone for listening, because honestly, we wouldn't be where we are without each and every one of you tuning in every week, supporting us on social media, really just helping us raise our voices with issues that matter. And I just wanted to go over some podcasting highlights with you guys. So I got some stats from Spotify. So that's one of the platforms that we're on, about our episodes and listenership in 2023. And it told us what our top episode was. So I'm going to ask you, Amie, any ideas on what our top episode was for the year?
Oh, that's challenging. With going bi-weekly, I know even there's less, but what our top episode was.
This is a tricky one. Do you want me to
give me a couple hints? Like give me a hint.
It's something to do with, I don't want to say the word.
Don't say the word. Just like
okay, so it's blank versus blank system.
Is it public versus private?
Yes.
Oh, you know what? Of course that would be a hot topic, because again, I think we're going to continue to have this conversation in the new year. The fact that the conversation on privatized healthcare is not going to go away. And I think we have to start thinking about if it's going to be something that's going to come, what does that actually look like? How do we ensure that, the public healthcare system is still going to be maintained and that there's still equity within the system? But I think that we're going to see much more of it in the coming years.
Yeah, and if you haven't listened to the episode, it's actually called Destroying the Public Healthcare System to Fund a Private One, the New Wave of Healthcare in Canada. And this was actually listened to 576% more than your average episode.
Damn.
9% of your new listeners started right here.
Cool.
And actually 73% of you guys started listening to us in 2023, which is super cool. So we're hoping to get out to even more listeners. Right now, the top country is Canada. That's where we're from. But we also have the most new listeners. In addition to Canada, we have Brazil and the Philippines.
Okay, cool.
Our listeners' top podcast genres were true crime, comedy, health and fitness. And this is cool. So our podcast was shared all over, mostly by text.
Oh, cool. That's interesting.
Yeah, direct link, Facebook and WhatsApp. Let's see. So for 492 people, we are the top 10 podcast.
That's really cool.
Like in their rotation. And then we're actually number 1 for 54 people. This is just on Spotify. Yeah, so I just thought that was a kind of a neat rundown of our podcast.
Yeah, I mean, I think that every year we hope to continue to grow and to continue to have more courageous conversations and to continue to bring, I guess it would be the grit to healthcare conversations. So thank you for listening to us, staying, abreast about all of these healthcare issues and various political issues. And we hope to bring you more and more energizing and entertaining conversations for 2024.
Thanks, everyone. Have a wonderful holiday season and a happy new year.
Take care. Stay gritty.
Our book, The Wisdom of Nurses, Stories of Grit from the Frontline, is available for pre-order.
Thanks to all that made this possible, especially the many nurses from across North America who generously shared their stories, passion, and wisdom with us.
From us, the hosts of the hit podcast, The Gritty Nurse, we discuss stories of the challenges, heartbreak, and humor of life on the front line.
One of the enduring lessons of the pandemic has been the pivotal role that nursing plays in healthcare. Vital work that isn't widely understood or sadly appreciated.
We started the wildly popular The Gritty Nurse podcast to give voices to nurses all over the world, including more than 400,000 nurses in Canada.
We have become sought-after speakers and advocates for nurses and are called on regularly by the media to talk about a wide range of issues around the profession.
In our first book,
definitely not our last,
we take you to the front line of nursing to show the compassion, selflessness,
and dedication of professionals who not only give it all for their patients, but get up to do it over and over again.
Pre-order the book now at your major book retailers. It'll be available in print and audiobook format.
Thank you so much. Take care and enjoy The Wisdom of Nurses.